Dental fear, it's more to do with biology, I would say, rather than a weakness, because it involves a highly sophisticated, evolved biological system, which is designed to actually protect us from threats.
Each patient is so unique in what they're taking and how that affects their body and their oral health that you're having to find a way to provide a treatment plan that is safe for the patient.
With autoimmune diseases, we see a delay in the healing process. And the reason for this is the patient's immune system is hijacked in a way. So there's a more exaggerated inflammatory response.
How do systemic conditions like diabetes, reflux, or autoimmune disease show up in the mouth?
As we age, we do start to naturally go on more and more medications as part of the aging process or as part of some of the diseases that come about later in life, such as type 2 diabetes.
From a pharmacy and medical perspective, what's actually happening to the body when someone is anxious? Welcome back to the Mouth Off Dental podcast, where we have real conversations about oral health without the jargon and without making anyone feel silly for asking questions. Today's episode is one I think a lot of people are going to relate to because my guest has a background that makes so many everyday health questions finally click. Dr. Yelena is a practicing dentist, but she's also qualified as a pharmacist with a strong background in medical science, including immunology and infectious disease. Before dentistry, Dr. Yelena worked extensively in pharmacy, so she understands medications inside and out, how they affect the body, and how those effects often show up in the mouth. That combination is incredibly rare, and it's incredibly useful for patients. Dr. Yelena sits right at the crossroads of medication, medicine, and dentistry, which is exactly where a lot of confusion happens for everyday people. So many people are on long-term medications and don't realize they can quickly change things in their mouth. Dry mouth, dental problems that seem to start later in life, antibiotics that don't quite fix the pain, or dental visits that feel harder than they should. These are all things that we see or hear about constantly. What makes Yelena's perspective so valuable is that she looks at the bigger picture. She understands why certain medications affect teeth, gums, why anxiety can make dental treatment feel more intense, and why your dentist keeps asking about your medical history, even when you've just been there for a checkup. This episode isn't about fear or blame. It's about understanding what's going on in your body, feeling more confident in your health direction, and realizing you're not alone in these experiences. If you've ever thought, I brush and floss, so why is this happening? Or why did my mouth change after starting certain medications? Or why does the dentist make me feel so anxious? This conversation is for you. Yelena, welcome to the Mouth Off Dental podcast. I've been trying to line this up for a while, and thank you for making the time.
Thank you for having me today, and that is quite the introduction.
Now, this is fantastic, and I think we want to unpack. Because it is so unique and so specific, I would love to start with, your background. I think it's really important that we get a bit of an idea about how you started, how you came to, the combination of pharmacy and dentistry. I mean, it's very unique, and for most people, they visit a dentist, they're a dentist, but with this double degree, it's rare. So, how did this journey begin?
So I basically started off in medical science, after which I pursued my honours in infectious disease and immunology. At the time, I was working in a pharmacy and I was part of a really great team. I felt that the pharmacists were really experts in medications, and that ignited my interest in studying pharmacy. So I took on a Master's of Pharmacy degree. While I was studying that, I became more interested in medications, and I started thinking about pursuing a career in medicine as a doctor. I always had a really great relationship with my own dentist, and she said to me, well, what about dentistry? I never actually really thought about it that much. But as I thought about it, I thought, well, I think this is also a great career option. At the time when I applied, I thought I'll apply for both dentistry and medicine and almost leave it up to fate and see which one I get into. I was very fortunate because I got into both positions, and then I had a really difficult decision to make. Do I pursue the option that I thought I was going to pursue all along, or do I go for something completely different?
Yeah.
Dentistry appealed to me because I felt that it was a specialized area in that you're focusing on head and neck anatomy, the mouth, etc. So I decided to go down that pathway, and I've been really grateful ever since. I'm in a great career and part of a wonderful team of people.
I think it's a real crossroads when you come to, because they're both great industries, they look after people's health. Just dentistry is probably a bit more hands-on. That hands-on approach, did that appeal to you a little bit more?
Absolutely. I think that, it gives you the opportunity to do something that is labor intensive. I don't know if you've heard people talk about things like art and painting, that you're so focused on what's in front of you that it's almost a form of mindfulness. And I find that dentistry is a lot like that. All my other thoughts just go out the window, and I'm just focusing on what's in front of me. And I really enjoy that aspect of it.
How has your background shaped the way you communicate with patients?
In terms of day-to-day treating patients, it comes into daily practice all the time. So, for instance, there are so many medications out there that the names become confusing, and there's generic medications also available. So a lot of the time people will be prescribed something, they'll be changed to a different medication, or they'll be given the generic option, and it kind of goes through this tunnel where they don't know what the name of it is anymore. And I'll ask them, what are you taking? And they'll say, oh, I can't remember the name. It's that little white pill, which could be anything. So, I'll ask them, well, is it a blood thinning medication? And then I'll give them names and examples, and they'll say, oh, that's the one. And the reason why that's so important is because it really affects how I'll treat that patient. And it becomes part of the planning process so that we can give them a solution that caters to their particular needs, that makes sure we're treating them in a way that's safe and appropriate, and that gives them the best possible outcome.
It's fairly holistic approach. You're understanding what's happening on the inside and surrounding circumstances, and it affects oral health.
Absolutely.
Yeah? Many people are on long-term medications without realizing that it does affect their oral health. And what are the most common medications are you seeing that can cause issues?
So blood pressure medications, antidepressants, anxiety medications, even asthma puffers.
Yeah.
So all of those things can cause dry mouth, or what we call xerostomia. So dry mouth is more serious than people think.
There's a huge population of patients that come through that a lot of people are on medications.
Yes.
They're on something.
Yes.
And that's got to be quite dynamic. Each patient is so unique in what they're taking and how that affects their body and their oral health, that you're having to find a way to provide a treatment plan that is safe for the patient.
Absolutely.
I mean, there's over 500 medications that can affect your oral health. I looked that up the other day. I found that incredible. Dry mouth can cause the risk of the decay to increase by 5 times.
That's correct. So the reason being is that these medications actually inhibit saliva, and saliva is really, really important in maintaining a healthy oral cavity. So saliva is full of oxygen, which selects for the more healthy types of bacteria. When you have reduced saliva, there's less oxygen in the mouth. So that means that the more inflammatory type of bacteria predominate. And that's definitely what you don't want, because this inflammatory bacteria is what causes the issues that we see in the mouth in terms of gum disease and dental decay.
So the saliva neutralizes acids in the mouth.
Absolutely.
Which helps prevent decay of
That's
teeth.
correct.
Without saliva, then it opens the doors for other issues to take over.
That's correct.
Yeah. It's interesting on that point that we have had some patients where their front teeth are really far forward, they're proclined, and they're exposed a lot more than the rest of the mouth and to, your outer body, out of the mouth. They're quite dry, they're not getting as much saliva as you'd think. And you can start to see that they start to go a bit yellow and tarnished. What's happening there? Do you know? They're bucky, and you can start to see that they got that real yellow banding on those those anteriors that are very much that they're never really in the mouth. The patients find it hard to close because they haven't undergone orthodontic work or anything like that, and it can cause looks like their teeth are starting to go yellow.
Mm-hmm. So basically what's happening is the teeth need to be exposed to saliva. When they're exposed to air, they're no longer being bathed in all the calcium and other ions that are present in saliva, and this causes them to be more likely to decay.
Yeah.
It causes them to become more yellow. And it's definitely just going to be a downhill journey, not only for the teeth, but also for the gums.
Can happen quite quickly.
Absolutely.
Yeah.
Absolutely.
Yeah. So if you're on medication and your saliva starts to really take a few steps back, things can change fairly quickly.
That's correct. And I think a lot of people are not aware of it until often it's too late.
Antidepressants, blood pressure medication, asthma puffers, reflux medication.
All of these things.
I mean, people blame aging, but often it could be the prescription list.
That's correct.
Yeah?
That's correct. And as we age, we do start to naturally go on more and more medications as part of the aging process, or as part of some of the diseases that come about later in life, such as type 2 diabetes. So sometimes people say, oh, I had no issue until I hit my 40s or 50s.
Yeah.
What's happened?
Yeah. And why does this happen in those 40s and 50s?
Well, because of the medication side of things. So we call it polypharmacy, where you're taking multiple medications at the same time. So as you're aging, you might be accruing more problems, like I mentioned, with the type 2 diabetes. And then as a result of being on these medications, you get a bit of dry mouth. So you have reduced saliva flow, and that creates the perfect environment for bacteria to thrive.
It's like a cumulative effect.
Absolutely.
Of medications.
Absolutely.
Reassuring patients that this is common and explainable. I mean, why dental problems aren't always about brushing and neglect. This is outside of that. We understand that some patients can become complacent with their oral health, but this medications play a role that sometimes patient, no matter how well they look after their oral health, their medications are fighting against that.
That's correct.
Yeah. Gums naturally recede over time, exposing, teeth and roots that are more vulnerable to decay. And this exposure often increases sensitivity of the teeth.
Absolutely.
So gum recession, we're talking your 40s and 50s can start to happen. Bit of tooth sensitivity, you're on medication. It's starting to paint a picture here that there's always more than one thing happening.
That's right.
Let's move on to antibiotics. I mean, this is a huge part of dentistry, and we're prescribing antibiotics in many different treatment plans. Where's the big area of confusion? Why don't they always fix dental pain?
So antibiotics, they don't directly relieve pain. They target bacteria, which is causing the infection, but they're not actually pain relievers. Dental pain usually stems from inflammation, which may be due to pressure buildup from pus or nerve irritation, and these will persist even if the amount of bacteria is reduced through using an antibiotic.
I mean, most dental pain is from an inflammatory response.
Correct.
So, and the first thing patients, I need some antibiotics, and it suppresses it for some time. But the overuse can contribute to resistance,
Absolutely.
gut irritation, and it doesn't really cure the toothache.
No, because we need to address the underlying cause. So, for instance, you might have a cracked tooth, which is causing you a toothache, and you think, okay, I can't get to the dentist. I'll just quickly get some antibiotics. Maybe the local GP will be able to prescribe those to me. But that cracked tooth, although there's tooth pain associated with it, there's no actual bacterial component. So you're just giving yourself this dose of antibiotics, which is unnecessary, which, as you said, is increasing the risk of antibiotic resistance, and is going to be a problem for us later on when we do age. If we do need those antibiotics, they're not going to treat an infection as effectively later on because you've increased that resistance.
True infections like an abscess, which is a pocket of pus, antibiotics alone aren't enough.
That's correct. You would need to do what we call incision and drainage in that situation, and that would allow the pus to come out.
That's when some patients say, I taste this really funny taste in
Yes,
my mouth.
Absolutely.
And it comes and goes. I have antibiotics, it goes away, and then before you know it, a month or two later, it's coming back, and it's this cycle, which is really unhealthy. I mean, we need to address the primary concern, and that's assessing that tooth and taking care of possibly, there are many forms of treatment, but one of them is an extraction.
That's correct.
If it's too far gone, yeah?
Absolutely. That would be the more appropriate treatment rather than just throwing antibiotics at it.
Dental anxiety. We see this on a daily basis in the clinic. I mean, you and I can both relate. We take it very seriously. We want to make sure that everyone's experience in the clinic is as comfortable and relaxing and inviting as possible. But it's really hard because some patients are anxious from the moment they get in the car to come to the clinic. From a pharmacy and medical perspective, what's actually happening to the body when someone is anxious?
So there is an adaptive response to a perceived threat, but it's in an excessive form and it triggers the fight or flight response. So do we confront the threat or do we run away? And this causes adrenaline to flood the body, which makes your heart rate go faster. It makes you breathe faster. You start to tremble, you start to sweat, you might have a bit of anxiety and so forth. So in this sense, dental fear, it's more to do with biology, I would say, rather than a weakness, because it involves a highly sophisticated, evolved biological system, which is designed to actually protect us from threats.
I mean, every dentist hears, patients come in and say, I'm hard to numb. I mean, being anxious, does this play a role? Because the body's having this chemistry of many things happening in the body, the hormones, the adrenaline. Is this make it more difficult to numb the patient?
Absolutely, and it's all related to what we discussed earlier. So there's a release of stress hormones, there's a release of adrenaline, and this makes nerves more excitable and lowers their pain threshold. So patients might feel pain or discomfort even when the anesthetic is actually technically working.
So chronic pain, if patients are in constant chronic pain and they're taking pain relief medication for a long period of time, some people might have back injuries, for example. Can this affect the way that you numb a patient up because they may be a little bit more resistant than others to the numbing?
That's correct. So you might need to employ an alternate injection technique, or you might need to administer a higher dose of local anesthetic just to make sure that the patient is numb enough for us to proceed with the procedure.
I mean, there's systemic diseases that can show up in the mouth. The mouth doesn't exist just in isolation. Gum disease is linked to diabetes. How do systemic conditions like diabetes, reflux, or autoimmune disease show up in the mouth?
So with diabetes, there is gum inflammation and gingivitis, which can progress to inflammation of the underlying bone, a condition that we refer to as periodontitis. Also, there are higher rates of cavities because we see high sugar levels in the saliva, which give the bacteria a place to thrive and grow. So what we would see is pocketing around the teeth. We would see teeth becoming loose. We may see recession of the gum line.
Yeah. I mean, you'll see reflux causes
Yes.
acid, and you get that erosion on the back of the teeth.
That's correct.
But it happens over a long period of time.
Yes. Yes, it's a very slow process. And what we'll see is cupped or concave areas on the biting surfaces of molars. Teeth might look a bit more yellow. And this eroded enamel is more vulnerable to tooth decay. So what the patient might notice is their teeth might become more sensitive to hot and cold because there's less enamel there. It's been eroded away by the constant attack of acid.
Autoimmune diseases are most often recognised firstly in the mouth.
Mm-hmm.
Yeah?
Absolutely. So with autoimmune diseases, we see a delay in the healing process. And the reason for this is the patient's immune system is hijacked in a way. So there's a more exaggerated inflammatory response. That same inflammatory response, which is crucial for healing, passes the tipping point. There's less balance there. So you have a longer duration of the inflammatory response, more harm than good that's occurring, slower healing because of, for instance, an impaired blood flow into the area, all of these sorts of things.
Sometimes your dentist knows something's off way before the blood test.
That's correct.
And I mean, there are instances where you've recognised something and you've probably recommended to go get a blood test.
That's right. So we might see things like clear signs of a dry mouth, ulcers or blisters. The patient might actually come in and complain and say, I've got this burning mouth sensation. I don't know what it is. Or they might even say they've got an altered taste. So all of these things.
Yeah, they have a metallic taste.
Issue. Yes.
I've had that sometimes come up in the clinic where they say, I've got a real metal taste, a metallic taste in my mouth. On the surface, everything seems to be fine. So that's when it may be a referral to a GP or specialist is maybe a good pathway. Then they can dive a bit deeper into their bloods.
Definitely, yes.
Medications play a role in bad breath, decay, gum disease. I mean, bad breath is terribly embarrassing, but often are the medications the hidden cause?
They can be. So all of these things are linked to dry mouth. So as I mentioned earlier, these medications decrease the production of saliva, select for bacteria that thrive in a more inflammatory, dry environment with less oxygen present, and they stay in the mouth for longer, particularly if you've got, for instance, the tongue covered in this layer of food debris that's not being cleansed away because the function of the saliva has been impaired. So the food debris sits on the tongue. You've got the bad bacteria sitting there, essentially having a feast, and all of this contributes to gum disease, bad breath, and decay.
Some meds change the balance of the oral bacteria.
Yes.
So not just reduce saliva, it can change the way that bacteria engages with other bacteria in the mouth. You know, that whole symbiosis. There's not too much of anything at one time. Everything's in balance. But you start to introduce medication that affects the bacteria or types of bacteria in the mouth. One can overtake the other. We can lead to oral thrush.
Yes.
Yeah, is that a possibility?
Absolutely. So that's all linked to this tipping of the normal balance, and by not having sufficient saliva there, it can cause fungal species to thrive, which is what we don't want. And if you don't address it, it's just going to get worse over time, essentially.
How do patients treat oral thrush?
So there's an over-the-counter medication called Nilstat, which can be used. It's applied topically.
Is it like a lozenge or is it more?
There are oral drops.
Oh, right.
So with anything related to any sort of treatment, really, we always say localized treatment is better than taking a tablet because, you don't have to go through the liver, the stomach, etc. You apply it topically and it helps to address the issue, and it's a lot more effective that way.
What are some of the biggest myths you're hearing from patients? The kind of things that, we're all creatures of habit, but we Google late at night. What is it that you think that patients are Googling about their oral health in conjunction with their medication?
So one would be, is dry mouth normal as you age? To an extent, yes, it can be, particularly if it's related to the medications we mentioned earlier or to chronic diseases such as the type 2 diabetes. Another one is, can I stop antibiotics once the pain stops? I would say no, because the infection could still be there. So I would recommend complete the course of antibiotics, just make sure that we've nipped it in the bud so that we don't have to, take another course unnecessarily because you've stopped early.
Absolutely.
Is mouthwash always good for you? No, because it can hide or temporarily mask another underlying issue. So I would say, speak to your dentist if you're confused about mouthwash or if there's a particular one that you should be taking short or long term.
What is mouthwash doing? What's it doing to the oral cavity? When you're taking that mouthwash, there's all different types and there's ones that have a bit of alcohol in it and non-alcohol and mint and bubblegum flavour. But what's it actually doing? Its ingredient, what's it designed to do?
So the main one that we recommend is called Savicol. It has an ingredient called chlorhexidine. And what this does is it helps to restore the balance of good bacteria. It's almost like a probiotic for the mouth. And it has what we call substantivity, so it coats the gums and tissues and continues to have a therapeutic effect while you sleep. So that's basically what it's doing. But as we mentioned earlier, you would only use it for a short period of time. It's not recommended for long-term use. You would definitely have to do this in conjunction with your dental treatment and under the guidance of your dentist.
Practical take-home tips. We're always engaging with patients and we love to always give something that a patient can take away and be useful at their own pace, at their own time. From your perspective, what practical things can patients do to protect their oral health?
So I would say saliva stimulation strategies for people who are experiencing dry mouth.
Right.
Chewing sugar-free gum or sugar-free lozenges. Frequent sips of water also help. And there's also an oral moisturizer that you can use called Biotene. Can be purchased from your local pharmacy.
Yeah, actually, it's interesting, the Biotene, because I deal with a lot of patients that wear dentures and we recommend the Biotene product and you can get in a spray or a gel. Very effective.
Absolutely. So that will just help to relieve that sensation of dry mouth and get rid of the discomfort that's associated with it.
It's always good to have, at this stage, a communication between GP, pharmacist and dentist. It matters. So if you're a patient that's off to the dentist, load up the dentist with as much information as possible because it arms them with a real holistic idea about where you're going with your oral health. It's not just what's on the surface in the mouth. There could be more things underlying, and it gives the dentist, it arms the dentist with more knowledge about your whole treatment.
That's correct. So, for instance, if you're taking an injection for osteoporosis, we need to know about that because it's going to have an impact on what treatment we can and can't do. Are we able to extract a tooth? Are we able to extract multiple teeth? When was the last time you had that dose of injection? Do we need to look at referring to a specialist? Because at the end of the day, we want you to have a really good healing response. We want everything to be done in a manner that is safe and appropriate and essentially tailor-made to each and every patient.
Yeah, Dr. Yelena, we got to get you back. This can really go on for a long time because there is so much involved. I mean, medicine, dentistry, medications, everyone's unique. And there is a great deal of information that we can dive into more specific conditions. But thank you for coming on. I really think that people will get a real benefit in understanding a bit of an overview, the way you approach a patient, the way you approach dentistry, but you're armed with just another level of knowledge that really gives patients the confidence in knowing that you're providing dentistry, but it's dentistry plus that arm knowledge of medications. And, that's incredible. It's unique. And I think, patients will really benefit from being treated by clinicians like yourself that have those double degrees, which is fantastic. I thank you for coming on. I mean, this has been one of those episodes that reinforces that dentistry just isn't about teeth. It's about the whole person. Yelena's background in pharmacy and medical science shows us just how interconnected medications, health, anxiety, and oral care can really be. If you've ever felt like your dental problems started after medication changes, if you struggle with dry mouth, anxiety, or unexplained dental issues, this episode hopefully gives you some clarity. As always, this podcast is about education, not judgment, and about helping people understand their bodies better. Dr. Yelena, thank you for sharing your knowledge so openly. Thank you very much.
Thank you for having me.
And to everyone listening, if this episode has helped you, share it with someone who is on long-term medications or just avoids the dentist. We'll see you at the next episode of the Mouth Off Dental Podcast.